Welcome back. Well, Professor Innocent Uja, the president of Nigeria Medical Association, joins us next to give us his hands-on experience concerning what he's seen about the COVID-19. Good morning. Compliments of the season to you, Professor. Thank you for joining us today on the program.
Thank you very much, Chamberlain. Compliments of the season.
All right, so still talking about this COVID now and certain measures given the second wave indication in different parts of the world, the kind of steps, the measures that we are putting in place here, you, your team, doctors, amongst those who are on ground, health practitioners and professionals trying to see what they can do to keep us all safe. What is your impression of, yes, the protocols that they've given? I mean, a lot will kick in today. From what you've seen, how would you assess our performance in ensuring that we don't drop the ball?
Well, thank you very much. The second wave that we're talking about had been predicted, and Nigerians were told that there will be second wave. The scientists, Nigerian Medical Association, alerted the government and people of Nigeria that we should be prepared for the second wave. The essence is not how well we have performed, how much we have performed. The essence is the level of preparedness. There's no doubt that we are actually in for more troubles because we do not know the extent to which this will go, the COVID-19 will go. The second wave, we do not know. It appears that it is again an importation. Otherwise, 270 people testing positive. Where are they coming from? They needed to be mapped to know which countries they are coming from and whether, in fact, they smuggled themselves into the plane or that they did not do the test or that the test is fake. These are some of the questions that we will ask. And I'm happy that the government is putting a stringent measure to ensure that people are properly tested before they come in. Now, those of us who are in here, the issue of compliance with the NCDC protocol is a very big challenge. Use of face mask, hand washing, sanitizers, and social distancing. And I have said several times that the issue of social distancing has failed in Nigeria, and it is not likely to succeed. And therefore, we need another strategy, another way of seeing how we can improve the compliance to the NCDC protocol. Yes, by and large, many people are now using the face mask. Unfortunately, if you go to the villages, marketplaces, this is not practiced at all. Maybe it's areas like airline and some other few places and the churches that people are putting on face mask. So we are really, in my opinion, we need to work very, very hard. Nigerian government, the doctors, of course, the doctors are ever committed to this cause, and we charge them not to relent in their effort, in their commitment, in their calling, despite the harsh operational environment. We talk about hazard allowance. We do not know what is happening at the moment after the hazard allowance pay for 3 months. They said 3 months. Now we now know that scientifically we couldn't have predicted that. But the reality is that COVID-19 is with us, and we need to up our games. The stakeholders, not just government alone, stakeholders, the Nigerian people, the National Orientation Agency must also improve its own communication channels and also sensitization of the public, because we really are in trouble if we do not act very quickly. We have lost time, and we now need to catch up with the time. How well we are prepared, I'm not sure. But
what kind of information
is the fact that...
Just hang on. What kind of information are you getting in terms of why is it that the compliance level, people are weary of it?
Well, that is another research question, and that is what PTF should have come out with by now, because I have always talked about the research angle of the PTF. We need to find out. We shouldn't continue to speculate. We could have gone to town and would have got a quick response and the data and analyze the data to appreciate the fact that, to know why people are not complying. Then we, of course, we will navigate and see how they will comply. The truth of the matter is that many people do not think that COVID-19 exists. They think it's just a fake. In fact, some people call it conspiracy theory. And I don't think that that is correct. The disease is with us. But answering your question specifically is that we need the research angle of this response. Now, we need to continue to evaluate our actions. We need to monitor our actions and see the response. Wherever we are doing well, we should do better. Wherever we are not doing well, we should begin to do well. And how do we do that? It's only by research findings. And I have talked about this. It appears very simplistic, but these are issues that we need to address. By now, PTF should have told us why people are not responding, because we need data. It's not enough to speculate. Science is about facts and figures, and we want to plead with the PTF to do put a quick proposal together, send out scientists, social scientists, doctors, nurses, and the rest out, those who have the capacity and capability of carrying out this study, so that we find out in quantifiable terms, just like we are told, that
Prof,
one day,
if you could just also take that on board with this one. Just one moment.
Sorry.
What you have also said, I mean, you have also indicated, certain likely reasons why people don't seem to be taking this seriously. But the research angle, given that according to one of your members in the FCT, he said that across the country, 20 doctors have lost their lives. NMA has lost 20 of its members as a result of COVID-19. You may want to confirm that or refute it, but isn't that a good reason for the NMA to also say, you know what, maybe we should step into this, research angle as well, given that it is something that you also do, so that we can at least mitigate our frontline soldiers, which are members of your organization, in this fight?
Well, I completely agree with you. First of all, whether 20 or one person, one doctor dies in the process, is a big loss, not just to the family, not to the individual, but even to the country. We don't want anybody to die in the process of serving his own country. That is why we talked about infection prevention and control. And we believe that we working with federal government, PTF, and Federal Ministry of Health, we need to continually train our health workers, doctors, nurses, and anybody who has something to do with patients on infection prevention and control. We need to do that.
Doctor, I was speaking, Professor, I was speaking about the research angle.
Have a lot of money.
One moment. I was speaking about the research angle that you talked about, that, maybe we should, maybe it is something that the NMA, research unit or department can take on.
Yes, that's what I was coming to.
Okay.
What I was saying is that in doing so, we need the support of PTF and the Federal Ministry of Health, because the NMA does not have luxury of money. We need funds that will make people move out. What we can supply, which we have the capacity and ability to do, is those who will carry out this research. What we don't have is that we don't have sufficient funds to move around the country. So what we need to do is to interface with the PTF and Federal Ministry of Health, so that they can provide funds for us. And as we're talking about fund, the issue of hazard allowance has now been, is no longer discussed. And we will take on the Federal Ministry of Health and Labor and Employment very quickly in the new year, because we cannot continue to increase the risks and subject our doctors and nurses to the hazard. The hazards are too many. And we think that this is where the government, and I'm happy, and I'm grateful to Mr. President for mourning with us, for losing many of the doctors. In fact, not just to the doctors, but to the Nigeria and the economy and the practice of medicine. So in this case, I am happy that if we now approach the Federal Ministry of Health and PTF, they would come to face with us so that we can discuss, because we have the manpower to do this, but what we don't have is the enabling environment, including funding.
Yeah.
And I think that this is where we would work with government and work with the Federal Ministry of Health. Yes, we are prepared to carry out the research. We're prepared to put the proposals and carry out the research, analyze the research, and then let Nigerians know why Nigerians are not complying with the NCDC protocol. And it is not as difficult. All we are concerned or that is required is the willingness to do so.
Yeah. Well, Professor, one of the things that a number of people have also, alluded to is the possibility, one of the possibilities is that maybe it's because the fatalities is not so high, and consequently people are saying like, look, people aren't dropping dead all over the place, so what's all the hoopla about? So maybe that's one of the reasons that say, look, we're going to die of one thing anyway. There are deadlier diseases in Nigeria than COVID-19, and a good number of people actually fully recover from it. How do you react to that?
Well, again, if we are waiting for people to die on the road before we intervene, then there's no need to have doctors, because we have what we call preventive medicine. We want to prevent. We don't want people to die. Doctors are trained not to be looking for dead people. We are trained to prevent people from dying. And even if we say so, let there be evidence that people say they are not seeing people dying. How many people have Nigerians seen dying, even in the hospital? Not to talk about a situation where the whole world is on its knees because of COVID. So that issue, that statement is, I think, is largely for those who are illiterate. Nigerian doctors and doctors anywhere would not want any one of his patients to die. And we have a branch of medicine called community medicine and preventive medicine. This is the discipline that ensures that people do not die. We intervene early, prevent deaths, prevent ill health, and promote health. And in that case, that is what we as doctors will continue to preach, and what we will propagate, what we advocate, and what we will engage with government to do, so that we do not need people to die or to be seeing dead bodies on the road before we can believe that there is COVID-19. Nobody that dies is being put on the road from other diseases put on the road. So why should anybody be on the road before dead? Should die and be placed on the streets before Nigerians will believe. In any case, Nigerians do not believe in anything except how they can get money. Now, what we are looking at is that we should ensure that people should be well. They should not die. And if they are not going to die, and we wish that they don't die, then we must prevent the deaths. And these are some of the strategies that we put in place. And I think that National Orientation Agency and other organs, the press is doing its best, but other organs in various languages should begin to let people know. I think that we have lost a lot of time in terms of information dissemination. I don't know why the much we expect from National Orientation Agency is not happening. I'm sorry, but that is true. I monitor many of these activities as the president of Nigerian Medical Association, how we can reduce the incidence, reduce the fatalities, reduce the ill health. And in fact, it's not just health. As you can see, the economy is affected, social activities are affected. Therefore, every component of human development is affected because of COVID-19. And nobody should have the illusion that COVID-19 does not exist. Even policymakers are making statements that COVID-19 does not exist. And it's very painful when the whole world is on its knees because of COVID-19, and then somebody will come out and say that it does not exist. I think that is misinformation, and that is disinformation. Diseases must be seen as a pathology, and people should not play politics with ill health.
Well, Prof, that is a reality of our time now. But when you alluded in passing to the economy, that is a very strong component in terms of that determines how people conduct themselves. Because now the economy is tanking, and people feel, look, they need to survive first of all. So it's a delicate balance. People are trying to ensure that, they eke out a living while still complying with the protocols, because all of the stimulus packages, if not most of the packages, if you ask people out there, they haven't gotten that much from the authorities. And so people feel, look, we're responsible for ourselves. So isn't that going to make it a lot more challenging for government's message to sink into people, telling them to comply with COVID, whereas the economy, they have to fend for themselves?
I agree with you. It's obviously a delicate balance. But you see, it would have been much better if people were complying with the NCDC protocol. If they were complying with the NCDC protocol, then of course we can go ahead. After all, the airplanes are moving, and you see that we have to comply. So if people are complying with the NCDC protocol, then the issue of economy can then be situated properly. But the situation where people are not complying, they don't even if you don't admit that something exists, if you don't believe in it, you will not comply. And this is why we are saying that probably there would have been a background research activity, very fast one, so that the rapid research activities would have taken place. Let's really find out, even if we know that because of the fact that palliatives are not being given or sufficient palliatives are not being given, and therefore people are not complying, let it be quantified for records and for policy development, and to look into the future. COVID will not be the only pandemic that will happen in this country and probably in the whole world in future. And we can use the knowledge and the experience gained now to improve the future, right? We are talking about our health system that has, in fact, that has completely collapsed because of COVID. It's clear that we should learn lessons from this.
Speaking about the lessons,
should put in place a crack team.
Just add this to your further response, Prof, because, the government had said that they didn't know that it was this bad. So, as professionals in that field, have you seen any intervention on the part of government to ensure that the capacity of our healthcare sector is a lot better than before COVID hit?
Well, I think that you want me to make a statement. The truth of the matter is that I have no evidence, because we have not done any study to find out whether it was better. But certainly, even a casual look will know that things are worse than they were. And it is the concentration on COVID has even sidelined other areas of need. And it's probably justified. But the truth of the matter is that what I'm saying is that we should learn from what is happening now so that we can improve for the future. Because the way it is that it doesn't appear that we will learn any lessons. Because to learn lessons, we must have evidence. And how do you have evidence? By gathering information through research and data. And with that, you should be able to plan for the future. I believe that if we do this, probably, and then of course continually talking to the community. You know that Nigeria is largely an illiterate community. And when you finish talking somebody, if you read the social media, the news that goes around all over the place that COVID is a white man's conspiracy. And this, again, that is deceit. And because we are illiterate, and many of us Nigerians are gullible, we will take this. They should listen to experts. That is why we are trained in this area. And if they don't listen to experts, it's disastrous. Even the president himself had said before, and now, that people should listen to experts, not charlatans. Charlatans make more noise than those who are properly trained. And doctors are not supposed to be on the field, making us up and down. We have our own way of communication. And we leave the general communication to the National Orientation Agency and its other organs like that. So what we are doing is to intensify the efforts. PTF should intensify the effort. The Nigerian doctors are ready and will continue to train. They should support us. so that we can train many more of our members, because we don't know how long we are going to go, in the containment and the national response of COVID-19.
Therefore, Prof,
we need funding to train.
Yeah, just a couple of things before we wind down.
Allowance.
Pardon me, just a couple of things. Of course, it's not just in Nigeria that people are asking questions as to the veracity or authenticity. People ask questions about things they don't understand. So it's not just here that those questions are being asked. Okay, well, let me talk about this now. The vaccines, Prof. Now, that's another area where there are huge questions, because it's one thing for government to say we're going to spend about 400 billion to vaccinate 70% of Nigeria's population, but there are a huge challenge where they'll face, because lots of people keep saying to us, look, they don't see themselves taking this vaccine.
Well, the truth of the matter is that vaccine is not new. We give vaccine for yellow fever, we give vaccine for preventable communicable measles. So vaccination is not new to Nigeria. We've just eradicated polio, and this is as a result of vaccination of our people. So obviously people will ask questions, but what we need to do is to provide them with answers, because of the level of ignorance that we face among our community. And unfortunately, when you are getting people to understand the rationale for this, there are some other people who are very quick to go underground to say, don't take this. This was happening in the case of polio. In 2003, I'm aware that even those who are educated, who should know, say that people should not take polio. But I'm happy we have overcome that, and polio has been eradicated from Nigeria. The issue is that people will continue to ask questions, and they have the right to get the answers. So we will continue with this. It will not end. It will be a continuous process. People should be given the right information so that they can respond appropriately. If one of the things I had talked about before, and I'm saying this now, is that the vaccines will come out, and we will need, if it comes to Nigeria, we need to quickly do our own evaluation of that vaccine. I am not sure. I cannot say with 100% certainty that in the process of developing this vaccine and the clinical trials, whether any African countries were involved. I'm not too sure, but it is possible. But if not, then because of the biology, because of the environment, because of our genetic composition, we need to do our own clinical trial very quickly before it can be used, on Nigerians. While we do not question the efficacy and safety, these things vary from place to place. The responses vary from place to place. Recall that when we were using chloroquine, some parts, the southern part of the country was not responding to chloroquine. The north part of the north were, but in totality, it was thought that chloroquine was no longer effective, and we changed. So what I'm saying, in fact, that if we have to use vaccine, we need to do our own quick clinical trials and see. Well, everything that is happening now is emergency. Even the COVID, the vaccine that have been produced within 9 months is an emergency. Otherwise, vaccine production does not just take within 6 to 9 months. It's a process. It's a process, from phase 1, phase 2, phase 3, and then, of course, phase 4 is the marketing. Therefore, if we are saying that we could do this as an emergency, then when it is imported to Nigeria, we should also do our own clinical trials to, one, establish the efficacy and the effectiveness, and also to look at any areas that probably our people are not favorably disposed to in terms of reactions, in terms of allergies.
Well, Prof, just before we go,
these are expected, but we should quantify them and say this is the much we have.
All right, Prof, we need to thank you for coming on, even though we're just delving into that vaccine in terms of what are we doing here. When last did we get a vaccine? Why are we not getting it? But I guess those are subjects for another day. But we do thank you for your time this morning, Professor Innocent Oja, President of the NMA. All right, then. So
thank you very much, Chamberlain, and Happy New Year. We hope that 2021 will be a better year than 2020, which is disastrous.